7, we are talking about environmental emergencies. Your first word today is going to be snow. Although we are talking about heat-related illnesses first. Fact or fiction, in order from least to most severe, the heat-related illnesses are heat exhaustion, heat cramps, and heat stroke. That is fiction. It would be heat cramps, heat exhaustion. From least to most severe, it is heat cramps, heat exhaustion, and heat stroke. The best prevention strategy for heat-related illness is to stay properly hydrated. That is true. Staying hydrated helps to make sure fluids lost through sweating are replaced, which helps you reduce the risk for experiencing a heat-related illness. Water is the best choice of fluid for staying hydrated. Drink a few ounces every 15 to 20 minutes or however much you need to not feel thirsty. Heat-related illnesses only affect people who are outdoors. Fiction. Being outdoors is a risk factor for developing a heat-related illness, but those illnesses can also affect people indoors. People who live or work in buildings that are inadequately cooled or ventilated are at risk, or those who perform indoor jobs in hot, humid environments. Heat stroke is life-threatening. True. A person who is showing signs and symptoms of heat stroke needs immediate cooling and medical attention because heat stroke can be fatal. If recognized early, heat cramps and heat exhaustion can usually be corrected with first aid measures. True. When a heat-related illness is recognized in its early stages and proper care is provided, it can usually be reversed. If a person is experiencing signs and symptoms of heat-related illness, is responsive, and is able to swallow, you should offer the person small amounts of cool drink containing carbohydrates and electrolytes, such as a commercial sports drink, coconut water, or milk, or water if one of these options is not available. That is true. A cool drink containing carbohydrates and electrolytes, like a commercial sports drink, coconut water, or milk, is preferred for rehydrating when a person is experiencing signs and symptoms of heat-related illness. Cool water can be given instead of drinking containing carbohydrates and electrolytes is not available. Only give the person fluids if the person is responsive and able to swallow, and encourage the person to take small sips rather than gulping and drinking it all quickly. Going into cold-related emergencies. Hypothermia is a potentially life-threatening condition that occurs when the body loses heat faster than it can produce heat, causing the core body temperature to fall below 95 degrees Fahrenheit. Children, the elderly, and people with health conditions that affect circulation are particularly susceptible to hypothermia. Does the air or water temperature have to be below freezing for hypothermia to occur? That is not true. The air or water temperature does not need to be below freezing for hypothermia to occur. Factors that can increase a person's risk for hypothermia include prolonged exposure to cold, wet or windy conditions, and wet clothing. Signs and symptoms of hypothermia include the person may seem indifferent, disoriented, or confused. They may have a glassy stare. They may become unresponsive. And initially, the person may shiver, but as the core body temperature continues to decrease, the shivering may stop. This is a sign that the condition is worsening and needs immediate medical care. If you come across a person who you believe may have hypothermia, should you get the person someplace where he or she can take a hot bath or a shower, give the person a shot of brandy or a cup of coffee, or move the person to a warm environment and make sure they're wearing dry clothing and wrap them in a warm blanket. All right, you are going to want to do option C, okay? You want to make sure that they are gradually warmed up and you're not just throwing them in hot water. And B is incorrect because alcoholic beverages and beverages with caffeine should not be given, especially if they are not able to swallow. Call 911 or the designated emergency number if you think a person has hypothermia. Move them to the warmer place, remove their wet clothing, and then help the person warm up gradually. Frostbite is an injury caused by freezing of the skin and underlying tissues as a result of prolonged exposure to freezing and subfreezing temperatures. The nose, ears, fingers, and toes are most often affected. The frostbitten area is numb and the skin is cold to the touch and appears waxy. The skin may be white, yellow, blue, or red, and in severe cases there may be blisters and the skin may turn black. If frostbite is severe, the body part may need to be amputated. Frostbite can be treated by rubbing snow over the affected area. That is false. Treatment of frostbite starts with gradual rewarming. Rubbing snow or anything else can only cause additional pain and tissue damage. Gently massage the frostbitten area to restore circulation and warm it up. Fact or fiction? That is false. Handle the frostbitten area gently. Massaging or rubbing it can cause additional pain and more tissue damage. Immerse the frostbitten area in hot water. Apply a heating pad and hold it close to a fire to rewarm the tissues. That is also false. You do not want to rewarm it with direct heat. It could cause additional damage. All right, if the frostbite is severe and the person is also showing signs and symptoms of hypothermia, call 911 or the designated emergency number. Do not break any blisters and monitor the person's condition if the person develops signs and symptoms of shock and give care accordingly. Do not attempt to rewarm the frostbitten area if there's a chance that the body part could refreeze before the person receives medical attention. Once the rewarming process is started, the tissue cannot be allowed to refreeze because refreezing can lead to tissue death. If rewarming is attempted, skin-to-skin contact may be sufficient to rewarm the frostbitten body part if the frostbite is mild. Alternatively, you can rewarm the frostbitten area by soaking it in warm water, no more than 100 degrees Fahrenheit, until normal color and warmth returns, so that should take about 20 to 30 minutes. After rewarming, loosely bandage the area with dry, sterile bandage, and if the fingers and toes are frostbitten, place cotton or gauze between them and loosely bandage the area with a dry, sterile bandage. Moving on to poisoning. A poison is any substance that causes injury, illness, or death if it enters the body. It can be entered through being swallowed, inhaled, absorbed through the skin or the eyes, and injected. Some examples of poisoning can include cleaning and laundry products, items commonly stored in garages, sheds, car maintenance areas, bug and weed killers, fertilizers, and paints. Medications and vitamins for people that aren't supposed to be taking those medications and vitamins. It could be plants and gases such as carbon monoxide and industrial gases. Signs and symptoms of poisoning may vary depending on the type and amount of poison taken in the body. The person may experience gastrointestinal signs and symptoms such as abdominal pain, nausea, vomiting, and diarrhea. Respiratory signs and symptoms such as trouble breathing or breathing too fast or too slow. Neurological signs and symptoms such as changes in levels of consciousness, seizures, headache, dizziness, or weakness. Skin signs and symptoms such as abnormal skin color or sweating. Checking the scene, and the person will often yield clues as to the cause of the person's illness. Make sure to look for open and spilled containers, unusual odors, burns around the person's mouth, or a strange odor on the person's breath, and the presence of other people who are ill. First, when you check the scene, you're going to want to size up the scene and form your initial impression. Make sure you remove the person from the source of poison if you can do so without endangering yourself. Take note of any clues that might indicate what poisoned the person, and try to find the type of poison, the amount taken, and when it was taken, and how much the person weighs. If the person is showing signs and symptoms of a life-threatening condition, for example, unresponsiveness and trouble breathing, make sure to call 911. If the person is responsive and alert, call the National Poison Help Hotline and follow their advice given. Do not give the person anything to eat or drink unless you are told to do so. And if you do not know what type of poison what type of poison it was and the person vomits, save a sample for analysis. All right, and there is your Poison Help Hotline. Your last word for today is going to be banana.